Hi, Mary. This is Ben McGee, and today we'll be talking about the ethical dilemma of universal healthcare in America. So, starting with what our healthcare is currently like in America, we have both private and public healthcare, with public being Medicare and Medicaid covers some patients, but the majority of our patients are privately insured, that is, where the business that they work for provides them a benefit of health insurance. And so we follow what is called the out-of-pocket model, where the majority of Americans will pay out of pocket for medical expenses, whether that is a copay or a large portion of their medical bills. The majority of Americans end up paying out of pocket for at least some of their medical care that they receive. So who pays for your health care? This is a question to make some people think, because the majority of Americans would say, oh, well, my business gives me health insurance as a benefit for working for them. Well, not everybody may be able to receive those benefits, like if you work part-time or if you work for a small business that may or may not be able to afford to give all of their employees health care. So it gives sets into perspective for some people. And then, is there a true standard of care? We know that Medicare and Medicaid funding, that people have to come in and make sure that it meets their standards, but that doesn't cover all of our patients. And so if we were to have a universal healthcare system, then that standard of care may be greater, or it may be more standardized across the entire country. Why is there even an ethical concern? Premiums have increased 97% from the year 2000 to the year 2009. Medical expenses are the #1 cause of bankruptcy in America today. That's almost 62% of our bankruptcies. There's 78 million Americans who are uninsured during COVID-19. So that's almost a quarter of our population was uninsured because of all the job losses and people becoming unemployed and having to file for unemployment. They lost those benefits. And why does it have to be so expensive? There's a lot more overhead administrative costs with our current healthcare system and insurance system, and there's no standard rate for drugs and equipment prices. So moving forward, there's about two different ideologies for both sides. So why should we adopt universal healthcare is a more of a utilitarianist argument. So the average ICU visit costs roughly $80,000, and that's not including pre-ICU and post-ICU. There's $66 billion per year lost in productivity just from obesity alone. There's argument where if we had universal healthcare in America, there would also be an increased funding for to help prevent people from getting sicker. So more preventative conditions such as obesity that can lead to other diseases. So there may be more money funded to getting kids more active and making sure adults are more active to help prevent obesity. The U.S. signed that medical care is a human right. So this was on December 10th, 1948. The United States, along with 47 other nations, signed the United Nations Universal Declaration of Human Rights, and that document did state that medical care is a human right, which is not seen in America today. And there are 44,000 deaths annually for those that are uninsured in America. And so that is just a utilitarianist idea where there'd be greater happiness for more people if there was a universal healthcare system. And so on the other side of the coin, there's the egoist version of why we should not adopt the universal healthcare system. There'd be a potential increase in wait times. This is seen in the United Kingdom and Canada, where there's more patients going to the hospital. If there's more patients going to the hospital, there's just going to be longer wait times for walk-in appointments. It could worsen the healthcare worker shortage. So we already know right now in America there's a healthcare worker shortage, and if there was a universal healthcare system, those who were previously uninsured that are now insured would then be able to seek medical care. Thus, more patients would be coming to the hospital, and that would probably worsen that healthcare worker shortage. There's the potential for overuse of medical centers. This is seen in the United Kingdom and Canada, where if there is a universal healthcare system, then you can go to any hospital or any medical center that you like. And so just it's whatever's most convenient to that person, which may not be the appropriate facility for them to get the care that they need. And then you would be paying for unemployed medical visits. So the idea of how we would pay for universal healthcare system is generally by income tax. And so if there's an unemployed person that needs if there's an unemployed person that needs medical care, then they would they would not be paying into the system that they are using is an egoist idea. So we moving on to how do we stand compared to other countries? Well, right now, the United States pays doctors higher than Canada and the United Kingdom, where in the U.S. the average salary is $300,000. Canada, it drops to $250,000, and the United Kingdom is $150,000 per year. The U.S. has the highest 5-year cancer survival rate at 67%. The UK trails at 54%, and Canada is at 60%. The U.S. ranks at number 2 in breast cancer survival. The only country that we are behind is Sweden, and Sweden does also have a universal healthcare system. And then the U.S. is the only developed country without universal healthcare today. So, for ethical frameworks, the American Nursing Association quotes that there's the need for and right to healthcare. The need for and right to healthcare is universal. The ANA also says that socioeconomic status does not affect a person's worth. And the International Council of Nurses says that the need for nursing is universal. So there is support in both of these codes for a universal healthcare system of some sort. So the impacts this has on nursing is a more competitive pay for nurses. Because there would be more patients, then there'd be a need for more hospitals. If there's a need for more hospitals, there's more job opportunities. And the more job opportunities we have, there'd be competitive pay because hospitals themselves would not be owned by the government, but they would still be businesses, whether or not they're non-for-profit or for-profit, that they would still be competing with each other to have to have nurses. And so one of the best ways to get more nurses would be to have more competitive pay. So there's also going to be a potential for larger patient teams. I kind of touched on this earlier, but with those who are uninsured now being insured and being able to go to the hospital, then there's just going to be a large influx of patients. And as I said previously, that when there's a greater need for patients, there's going to be a greater need for healthcare workers. There's already a shortage now of healthcare workers, and in a perfect world, we could say, oh, well, there will just be more people going into the nursing field and the healthcare field, but that's not always going to happen, as we see right now that we are in a shortage, and so that would only worsen the shortage, creating a larger patient team. But probably the most important part is standardized care across hospitals. I kind of touched on this earlier, but if all insurance was covered by the government, then there would have to be standardized care across all hospitals in America, where if you went to one in Illinois and one in California, you should generally be receiving the exact same care because that is what is being funded by the government. And then here's a list of my references. I will send this in so you can look at it more critically. And thank you very much.